Welcome back. My next guest has worked to make mental health care more accessible, both on college campuses and around the world. Here to tell about us is Jacksonville native Nora Sun. Welcome, Nora.
Thank you. Hello, everyone.
We're also joined by Dr. Laura Erickson-Schroth. She is the Chief Medical Officer of the Jed Foundation, which recently awarded Nora Sun the 2025 Student Voice of Mental Health Award. Dr. Laura Erickson-Schroth, thanks for being here.
Thanks so much, Anne. Great to be here.
All right. So, Nora, you are a rising junior at Harvard, although you're from Jacksonville. Can you just tell us how you first started working in and advocating for student mental health?
At the end of eighth grade, I moved from a suburban town in Illinois to Chicago, and I started to attend this large, under-resourced high school in the city. I struggled a bit with the stress of this transition, but unfortunately, wasn't able to find much support through my school. However, fortunately, my friends ended up helping me through this experience, and this kind of led me to recognize that peer support can truly be life-saving for people who have sparse access to mental health resources. And this eventually led me to develop an interest in advocating for mental health awareness.
And so you've kind of gone on personally to become an advocate, somebody that works and does peer support and serve as a resource for other people, much in the way that you were helped at that time.
Yeah, so I recognize that youth are oftentimes more willing to discuss mental health with their peers rather than adults, from my own experience and from my friends' experiences. I
Now,
also realized, oh, sorry.
no, go ahead.
I also realized that some youth might prefer to have these conversations online rather than face to face. So, as part of my advocacy, I created the Little Talks movement, which is this digital peer to peer mental health support network. So, youth often put off seeking help until a moment of crisis. And our goal is to help youth identify a peer they feel comfortable talking to about mental health before that moment of crisis.
And I want to talk more about those the Little Talks initiative that you mentioned there. But Dr. Laura, I want to bring you into this conversation. How did Laura earn this recognition through the Jed Foundation?
Yeah, so the Jed Foundation is a national nonprofit that protects emotional health and prevents suicide for teens and young adults. We work with K through 12 school districts, with high schools, colleges, and youth serving community-based organizations all around the country to help them build robust mental health and suicide prevention policies and programs. And every year we give out the annual Student Voice of Mental Health Awards to honor one high school student and one college student who demonstrate exceptional commitment to raising mental health awareness, to fostering connection and belonging, and encouraging help-seeking behaviors among their peers. And the winners receive a $3,000 scholarship, recognition on JED's platforms, opportunities to collaborate with JED. And this is the 18th year that we've done the Student Voice of Mental Health Awards. It was created in 2008, and since then we've had 27 students recognized for their contributions. And this year, I couldn't be prouder of Nora and all the work she's done. She had this experience of this difficult transition in high school, and she learned that connection with other young people was what made a difference for her. So she took that knowledge and she created this peer-to-peer support network that's helped so many other young people. As she said, and as our research shows at JED, many young people reach out to adults for things that they need, but for a lot of important questions and conversations, they start with peers as well. And so peer-to-peer support is crucial. And now Nora is doing really much needed research to advance the field of youth mental health. And I can't wait to see what she's going to do next.
And it's my understanding that the Jed Foundation, it's a national nonprofit, as you say, that it was initially founded in response to the founders who lost their son to suicide, and that they really wanted to create an organization, focused on ending shame and stigma around mental health issues and also promoting prevention. Um, can you talk a little bit about what progress has been made on that front?
Yeah, absolutely. So, in terms of the state of youth mental health right now, of course, young people are really struggling. We see that all around us. We're seeing rates of anxiety and depression that have been rising for years. Suicide is the second leading cause of death for young people 12 to 24 in the US. But we're actually seeing a lot of real reasons for optimism. One is that young people like Nora are talking about mental health more than any other generation. They're coming together, they're building community, they're finding ways to support each other through all the kind of changes that are affecting them. This generation is facing a really different world than previous generations. And then we're also seeing real progress with interventions aimed at improving youth mental health. So, for instance, research shows that from baseline to program completion, students that from colleges that participated in the Jed Campus program reported improvements in average anxiety and depression scores. They were 10% less likely to report suicidal thoughts over the last year, 13% less likely to report having made plans for suicide, and actually 25% less likely to report a suicide attempt. So there are interventions that are being put into place on a systematic level to change programs and policies within the places that young people go, that's schools and community organizations. And I think it's having a really big impact.
Nora, I want to ask you about your work in helping to develop some online resources because we hear a lot about how, you know, social media and other online um, programs or endeavors can be harmful to young people and their mental health. But you have founded an organization that actually, uses um, that connection to reach people around the world, people who might not otherwise have any access, perhaps, to a counselor or someone that they could talk to about a mental health crisis. Can you tell us a little bit about founding that organization?
Yeah, so I believe that even though the internet and the digital world today may have some harms to mental health, it can also be a very powerful tool to reach people who don't have any or many resources where they physically are located. In the past decade, there has truly been this amazing explosion in digital mental health tools. Unfortunately, though, the majority of these tools are only available in English. So, through the initiative I founded, Mercuri.world, youth translators translate these resources into 21 languages, and we disseminate them to local communities worldwide through our 31 international campus-based chapters. And our translated resources have reached over 6,000 people.
And so that is that organization that translates. But you have also, as we said, started this Little Talks movement, which is kind of an outgrowth of that other creation, which tries to foster a platform for peer to peer outreach and mental health support. Can you tell us a little bit more about how that works?
So, the Little Talks movement, the goal of our work there is to create a sustainable and supportive digital peer-to-peer network for mental wellness. So, a little talk is just any peer-to-peer conversation with a friend or acquaintance about mental health initiated on any digital platform. So, that could be texting, Instagram, Discord, or Reddit. And it might involve checking in, exploring mental health related feelings and experiences, educating on mental health resources and coping strategies, and just establishing an affirming space for potential future conversations about mental health. So the person who is reached out to by our mental health peer guide knows that they have someone who they can turn to if they ever experience mental health challenges.
And Dr. Laura, I mean, we talk about some help that's reaching people that perhaps couldn't have had help before, peer to peer being an effective way to deal with some of these issues. And yet there are also growing pressures, certainly on some groups that feel marginalized, that have gotten perhaps more pronounced. And I'm curious if you have a sense about, how it shakes out the balance of where we're moving in the world of mental health and resources, especially for young people.
Yeah, I think there are so many different ways that people are tackling the issue of, declining youth mental health that I think that we're actually making a significant amount of progress. We're thinking about things in more nuanced ways. Nora brought up the idea that, a lot of people talk about social media as a negative thing for young people, but actually, social media is something that is pretty complicated in the lives of young people, right? There are a number of potential negative effects. So there's, information overload, a lot of comparison, there's cyberbullying, this idea of hijacking of reward systems. As humans, we need social support and we need reassurance, and the algorithms that are built into social media are taking advantage of us and keeping us online. But there are also a lot of positives for many young people, about engaging online, especially, as you mentioned, for groups like LGBTQ young people who might be having trouble accessing support in their everyday lives. And so I think the conversations are getting a bit more nuanced, and we're talking about things like appropriate regulation of social media so that we have the ability to make choices about the content that we see. We're talking about much more complicated situations. It used to be that we were just saying, youth mental health is negatively affected by all these things happening in the world, but actually technology and the things that are happening and changing are things that we're paying a lot of attention to and we're able to tackle as we go if we have broader conversations, especially with young people.
Well, Nora Sun is a Harvard student from Jacksonville. She's the winner of the 2025 Student Voice of Mental Health Award. And Dr. Laura Erickson-Schroth is the chief medical officer of the foundation that gave that award, the Jed Foundation. Thank you so much for being here.
Thanks so much, Anne.
Thank you.